Okay, picture this. You're walking into a hospital for surgery, and you know it's probably a death sentence, not because of the knife, but because of what happens after. Today, we're getting into the story of Joseph Lister, the man who basically single-handedly declared war on the invisible killers that were haunting every operating room in the world.
So back in the mid-19th century, surgery was, to put it lightly, absolutely brutal. The biggest danger wasn't even the operation itself. No, it was the infections that came after, these infections that were just running rampant. You could have a simple fracture and end up needing an amputation. And those amputations, they often led straight to the grave. Doctors were completely powerless against an enemy they couldn't even see.
And what's truly just mind-blowing about this era is the attitude. Surgeons were actually proud of the filth. I mean, this quote right here says it all. The good old surgical stink was seen as a badge of honor. It meant you were experienced. The idea of cleanliness just wasn't even on the radar.
Places like this, the Royal Infirmary of Edinburgh, they were basically breeding grounds for death. They were filled with some kind of mysterious killer, and doctors blamed it on something they called miasma, or just bad air. They thought these foul smells coming from the wounds were poisoning the patients. So they were literally looking for the cause in the air, not on their own hands. So who was the man who was going to change all of this? Well, Joseph Lister had this really unique upbringing that just forged a mind capable of seeing what absolutely nobody else could. Yeah, his childhood was kind of the perfect storm of influences. On one hand, you had his Quaker parents, who gave him this really deep sense of moral purpose. And on the other hand, his father, Joseph Jackson Lister, was a pioneer in microscopy. He designed this incredible piece of equipment, an advanced achromatic microscope that got rid of visual distortions. It literally gave young Joseph the ability to see a hidden world. And boy, did he use it. From a really young age, Lister was just driven by this intense scientific curiosity. He wasn't just, messing around. He was doing real research. He was dissecting fish, small animals, and just meticulously examining their tissues under that lens. This kind of early training put him on a completely different path from everyone else. And all that training, well, it was about to be put to the test when he started his medical career. It was right there, in the hospital wards, that Lister came face to face with the true horror of the problem and began his hunt for the killer. And this is where you really see Lister's sharp mind clash with what everyone else believed. While all his bosses were convinced that infections came from bad air, Lister noticed something else during an outbreak of erysipelas. The infection seemed to jump from one patient to the next. He started to think, maybe the problem isn't some vague cloud of miasma, but a local poison that's somehow getting into the wound.
You can really see his scientific brain at work during a gangrene epidemic. He didn't just throw up his hands. No, he took tissue from a diseased wound, put it under his father's microscope, and he saw something, these peculiar objects that he thought might be a fungus. His conclusion was totally radical for the time. The disease wasn't bad air. It was a physical contaminant, something parasitic that was attacking the wound. So this whole line of thinking led him to a really pivotal moment in his life. He makes a move to Edinburgh, and there, Lister would find the final pieces he needed, a powerful mentor and an absolutely indispensable partner. This guy here is James Syme, basically the top surgeon in all of Britain. Syme saw Lister's incredible talent right away. He made him his house surgeon and gave him a huge platform at the famous Royal Infirmary of Edinburgh. But he wasn't just a mentor. Pretty soon, he was going to be family. That's because in Edinburgh, Lister also met Syme's daughter, Agnes, and their marriage in 1856, well, it wasn't just a romance. It was the start of one of the most important scientific partnerships in the history of medicine.
And let's be really clear about this partnership, because it kind of corrects a historical wrong. Agnes was his intellectual equal. She was his lab partner, his secretary, his closest confidant. If you look at his research notebooks, they're just filled with her meticulous handwriting. It's a silent testament to the critical role she played in his discovery that would change the world.
So at this point, Lister has the tools, he has the observations, and he has the support. All he needed was one final piece of the puzzle, a theory that could tie together everything he'd been seeing for years. And that piece came from the French chemist Louis Pasteur. See, Pasteur had just proved that these tiny invisible organisms, what he called germs, were the real cause of fermentation and rot. They weren't a result of decay, they were the cause of it. This was Lister's big eureka moment. He read Pasteur's work and it all just clicked. He made this brilliant connection, the same process that Pasteur was describing in wine, putrefaction. That's exactly what he was seeing in wounds. And that led him to the billion-dollar question. If germs are what cause wine to rot, what on earth is causing human flesh to rot?
And the answer was so simple, but so powerful and so revolutionary. Germs. The invisible killer finally had a name. That local poison he had been suspecting for years? It was actually a tiny army of microorganisms.
So, if germs are the enemy, you need a weapon, right? He found one in carbolic acid, which was this chemical they used to treat sewage. He started using it to clean everything, the instruments, the patient's wound, the dressings, even his own hands. And right there, that was the birth of antiseptic surgery. The results were immediate and incredibly dramatic. Death rates just plummeted. Lister hadn't just found some new technique, he had kicked off a revolution, and that's what earned him his title for all of history.
I mean, his legacy is just immense. He introduced antiseptic, sure, which turned surgery from a death sentence into a life-saving science, but he also championed rigorous scientific research, he pushed diagnostics forward with his microscope, and he fundamentally changed how we understand the way the body heals.
Think about it. Every sterile operating room, every single surgeon who scrubs their hands, every patient who survives an operation without getting an infection, they all owe a massive debt to this man, Joseph Lister. He took on an enemy nobody could even see, and just through careful observation and brilliant thinking, saved countless lives. So Lister's big battle was against the unknown germs of the 19th century. But today, we live in an age of antibiotic-resistant superbugs. And when you think about that, his war is really far from over. It just forces us to ask, what are the invisible killers that we're fighting right now?